if we do have greater costs and of people, millions of people falling off of coverage, that does lead to a smaller and sicker risk pool and higher premiums. But at the provider level, what it means is that those providers, those whether it's a hospital, whether it's an emergency room, whether it's a clinic, that means they have fewer paying patients and more uncompensated care. It means that people who don't have access to primary preventive care have their conditions get worse, and then they may show up in the emergency room with something that might have been prevented if they had dealt with it earlier. It means that those emergency rooms have less paying patients and are just financially more strapped and may have to scale back services, hours, or ultimately close. It means that um, we are not providing care at the front end, but only at the end, but actually in the most expensive, most inefficient way possible, which is at the emergency room on the back end. And that has a ripple effect through the healthcare system that we all rely on. And that's why people should care about this specific fight and as well as the broader set of Medicaid cuts that were in HR 1. You had this big bill that had all these cuts, and there's going to be ramifications. And these premium impacts are just the first of many impacts of cuts. We're going to see more as state legislators start trying to figure out what to do. If they're going to get billions of dollars less from the federal government to fund the Medicaid program, then what do they cut in benefits and services and provider rates? And those emergency rooms will have to deal with those cuts as well. These are redounding, cascading effects on our healthcare system. But again, the thing I want to be clear is these impacts are not inevitable. Um, we can take action. There's lots of times where Congress passes a bad bill and then retracts it, repeals it, rolls it back after public backlash. And the first thing we can do is have a reaction to the notion of these premium spikes. The first thing we can do is push back to prevent these premium spikes of for individual coverage, and then keep working to prevent some of the other cuts that are coming down the pike as scheduled over the next several years.